Hello there, welcome to Plus Talk on Plus Life, where we're all about turning positive into a plus, and today we're talking herpes. Why? Well, because it's important, especially for those of us living with HIV, and also the effect that it can have on possible transmission of the virus. Joining me today, Dr. Jeffrey Klausner. You are, is it fair to say, a bit of an expert in the world of herpes?
Yeah, so my mom wanted me to be a physician on Park Avenue, but I ended up being an expert in VD and herpes and gonorrhea.
Well, let's dive straight into it. First of all, can we clear up, there is a bit of a misconception, and I was guilty of this. A lot of people think HPV is herpes. Not the case, is it?
Right, so it is confusing because HPV and HSV, sound very similar, but HPV stands for the human papillomavirus, and that's the virus that causes warts and anogenital cancers. And HSV, or herpes simplex virus, is the virus that causes blisters and lesions and sores.
A statistic that I got off the website with you guys that startled me a bit was 30% of new HIV cases are directly attributed to genital herpes. Tell me more about that.
Yeah, so it's been known for a long time that genital herpes, which can cause small breaks in the skin, small breaks in the inner lining inside the vagina or the anus, or small breaks or tears on the penis. That provides a really good what we call portal of entry or window for other viruses like HIV to enter. So if someone has active lesions, or even if they don't have active lesions, sometimes they don't recognize sores or small tears or irritations. That provides a window for HIV to enter. So the studies have shown that people with herpes have about a 30% increased chance of getting HIV infected.
So, what do we do then, Doc? What do we do to protect ourselves other than obviously the use of condoms? But do things like PrEP help in these instances where herpes is involved?
Well, let's not gloss over condoms too quickly. I mean, condoms are definitely very effective. Remember, recognize I live in the real world that people don't use condoms all the time, and many people who are using PrEP use it for the purpose to avoid condoms. And PrEP, unfortunately, has not really been shown to protect against many other STIs, even STIs like herpes. It works very well at preventing HIV, as we know. So people who are on PrEP or on treatment for HIV do need to be thinking about how they can prevent herpes.
So, if I am HIV positive and I'm not on treatment, there's clearly I'm more infectious, especially when herpes is involved, right?
Yeah, so we know that if people are untreated with their HIV, many types of different STIs can increase their HIV viral load and help propel the forward transmission of HIV to other people. And that's why, I mean, the first most important thing is that one, someone knows their status, if they're HIV infected or not. Number two, if they are HIV infected, to be on, highly effective therapy, ART. These days, ART is very easy to take, one pill a day. It's either free or very low cost, and really, there should be not a barrier to people getting on effective HIV treatment.
I read a statistic about if you're on HIV treatment, so if you're like myself, you're HIV positive, you're undetectable, that and that you have the herpes virus in your body, is it true that it could reduce the frequency of outbreaks, of herpes outbreaks, by staying undetectable?
Sure. So if someone is well suppressed with their HIV treatment, so they have an undetectable viral load. Typically, what you see with that is an increase in CD4 count, and people will often, after a couple of years, even get back to a CD4 count in the same range in someone who is HIV uninfected. And once you have that higher CD4 count, you have a robust immune system now, and that immune system will help suppress herpes and reduce the frequency of recurrences, reduce the duration of recurrences, shorten outbreaks, and make it less likely that you will spread it to others.
How close are we to finding some kind of cure for this thing?
Well, so there are billions of people living with either type of HSV. Remember, there's HSV type 1, which can affect the lips or mouth or the nose, even sometimes the eye or the brain. And there's HSV type 2, which typically can affect the genital area. So when you combine those two, yes, you get about 6 billion people. I mean, there is very good work being done by a gentleman named Keith Jerome at the University of Washington, who's actively working on a cure. And he's actually shown us at Herpes Cure Advocacy, our advocacy group, new data that shows, evidence of, work very close to a cure in mice and in guinea pigs. We're hoping those studies are going to get into humans very soon.
That's amazing. So what are the sort of top 3 takeaways you really want people to think about when it comes to herpes related to HIV?
Number 1, know your herpes status. Number 2, if you're herpes positive, know the symptoms. As many people can have symptoms that they don't recognize as herpes. They can have genital burning, itching, redness that they might attribute to, things like a yeast infection, jock itch, vaginitis, maybe some kind of trauma that actually is related to herpes. So herpes doesn't necessarily typically have to be blisters and ulcers. It can have other unusual symptoms. So if they're positive, learn the symptoms. And if they're symptomatic, ask for suppressive treatment. So acyclovir or valacyclovir are generic, very safe medications that can be used for years. 1 pill a day or 2 pills a day added into the HIV treatment regimen. For actually many years, we were just doing that routinely. We thought combination herpes and HIV therapy would help people restore their immune system even faster. But now we know that the addition of these antiviral medications can suppress herpes, reduce spread to others, and can benefit people with symptoms.
Obviously, we know the great stigma that comes with living with HIV, but there's also a stigma that persists again with whether it's herpes or, let's be honest, any STI. We've got all these hang-ups about these things that come with the thing that a lot of us like doing.
Sure, sure. And, I mean, at Herpes Cure Advocacy, we're very sex positive. We think, sex is a very healthy thing. We want people to have sex, and, more sex is a good thing. And, stigma is real. And, part of the stigma comes from the risk is spreading to others. So historically, things like leprosy or the plague or tuberculosis, people were stigmatized because they could spread it to others. But with herpes, because we have tools to reduce the spread, like taking an antiviral medication for herpes every day, that can actually reduce the stigma because people would be much less likely to spread infections to others. We still need a lot of education out there. We need a lot of awareness to make people realize that, herpes can be treated, and, someday, hopefully, fairly shortly, it can be cured.
Well, there you go. Much like HIV, you can get on treatment and be undetectable. You can get on treatment for herpes as well. Dr. Jeffrey Klausner, thank you so much for this very interesting conversation and informative. I've learned a lot, so I really appreciate you taking the time.
All right. Well, you're welcome, and have a great day.
That's going to do it for this episode of Plus Talk. If you want more information, we'll have it all up on the website. And remember, you can follow us across social media platforms. We are at Plus Life Media and the website pluslifemedia.com. Until next time, take care of each other. Stay safe. See you soon.